Give all your thoughts a fighting chance. Ask your fears and doubts. Would you like to dance? And open up your eyes. See the world and let the world see you. Take the time to love the things you do, and you hear it when your spirit starts to rise.
Welcome to Path to Wellness. I'm Christian O'Neill. I'm your host. We have a wonderful guest today. This is Dr. Russell Baum. He's a doctor of Oriental Medicine. Thanks for coming.
Thanks for having me, Christian.
You're welcome. Okay, so a lot of people in the audience have some familiarity with Oriental medicine, maybe has acupuncture or tried some herbs, but for those in the audience who have never heard of it at all, maybe you could just give us a brief overview of what the system entails?
Sure. Oriental medicine is an ancient, more than 2,000-year-old tradition, which of course has become more popular in the West, in recent years. Basically, it's comprised of a dozen or more major meridians, which course the entire body, much like highways, course across the land. They correspond loosely to nerve pathways, but they are independent of that. And we found that the acupressure points, which are all along the body, legs, arms, trunk, there's hundreds, access these pathways or meridians. And so we can take and stimulate certain points and have them have different effects on the body.
Okay. And so this energy that you're talking about is chi?
Right, chi or ki in Japanese.
Okay. And so any disease tell me if this is correct, any disease in this Oriental medicine system the chi isn't flowing freely. Is that fair to put it that way?
Right. It's fair to say that where there's a lack of free flow of chi in the body, there's a disorder or an injury pattern or some area that's not working properly in the body.
Okay. Yeah. And the chi could be interrupted through an injury,
right, or
the other possibility is a chronic condition can lead to the chi not flowing correctly. Is that true? Right.
It's the chicken or the egg comes first, and really in Chinese medicine it doesn't really matter because it can kind of work either way. In chronic conditions, oftentimes an organ's dysfunctioning from emotions or from physical trauma or diet or whatever it is, a disease pattern, that can cause a chronic issue with a particular meridian in the body. Or conversely, you could sprain your ankle and that causes an immediate blockage in that particular meridian that needs to be addressed.
Okay. All right, and another thing that I just have a little understanding of is that the organs are viewed differently in Oriental medicine versus allopathic medicine. So
that's right.
In the training that I received, the heart has a circulatory function. It's pumping blood through the body, the lungs, gas exchange. The organs are a little different in Oriental medicine. Maybe you could tell us a little bit about that.
Right. I mean, organs are organs, but there are because we have a meridian system in Oriental medicine that connects to every organ, there can be effects. In other words, I can affect the liver organ, which is up here, by stimulating a point on my foot because of the connected meridian. So that's a way of accessing it that's different. In Western medicine, we simply look at it, well, the liver's here, and that's your ankle and bone and structure and all of that. They're very different things, where in Oriental medicine, they're very connected, and we can access them distally at other points in the body and have an effect locally at that organ because of the shared system that they have.
Interesting. I like that idea. It's a holistic view,
right.
and and you can. Technically, the liver and the ankle are connected.
Right. I mean, in a sense, everything's connected, right? We're sort of getting used to that idea that everything is connected. It's all in the body, but the connections are really profound and can be very therapeutic when you know where to access a particular organ. You can have an effect on that organ. Without having to necessarily do surgery or take a particular medication or what have you.
Interesting. Okay, so what are the other main aspects of Oriental medicine? You've got the chi flowing through the meridians, and then you can affect the chi through which techniques?
Well, you can affect the chi many different ways. Chi is an invisible force, which makes it difficult sometimes in allopathic medicine to grasp. But there are ways to visualize it with Kirlian photography. We can see chi actually on a hand or on an apple for that matter. So we know that it's in all living things. It is however, a visually invisible force. but it can have many effects on the body, and there's many ways to assess that. You can, even a massage can affect chi movement simply because you're, of course, physically moving the circulatory system as well, but because the energy channels are completely connected or not independent, we really shouldn't think of chi and meridians and energy flow or whatever you want to call it as being separate from the body and the physiology of the body. They're very connected. So when you do something to one thing, it's gonna have an effect on another. If I massage your calf muscle, it's gonna move blood, it's gonna do all that, but it's also gonna affect your chi flow, generally in a positive way is what you want.
Okay.
And because these things move in different directions of the body, yes, acupuncture is one way we can affect the chi flow. Acupressure can even affect it quite greatly, especially with people that are afraid of needles. Manipulation can do it.
Do the herbs affect chi flow?
Absolutely,
Okay.
strongly. In fact, different herbs have different energetic effects on different organs and different meridians, and it gets very technical, of course, and you have to be an herbalist to really get it. But the reality is, sure, different herbs affect the energy differently, so when you know which ones will produce certain effects that you want to produce, it can have a profound effect.
Okay.
And of course, even emotions affect chi flow strongly.
Mm-hmm.
So everything affects chi flow in different ways, both positive and negative.
Okay. So one of the reasons I wanted to have Russell on the show is because he has a different way of practicing than all the other DOMs, at least in New Mexico, as far as we know.
At least locally,
Okay,
yeah.
It's called BioSET, and maybe Russell can tell us a little bit about how that works.
Sure. BioSET is, the simplest way to describe it is it's like a multidisciplinary approach that is kind of a 21st century version of everything we've learned about energy medicine like acupuncture and oriental medicine, and more modern techniques like chiropractic and homotoxicology, homeopathy, things like that, enzyme therapy. It sort of incorporates a lot of different disciplines into it. It was developed by a doctor named Ellen Cutler, and it basically is it's got several different approaches. One is energetic. We couple that with a system called IQS, or interrogatory query system, which is essentially a sophisticated biofeedback machine developed by a physicist. And it basically is a way of accessing what's going on in the body's energy channels, meridians, if you will. And we can see that visually on the computer screen. We can hear it auditorily. We can hear what's going on. So it's just a really wonderful tool for accessing what's going on in the body, and another way of doing it that we can integrate with these other disciplines like acupuncture and all sorts of other disciplines. So
Okay, cool.
It's pretty neat.
It is neat, and I got to have Russell use the BioSET on me last week, and we've got some video footage of it, so we're going to show that right now. Let's take a look at it. Hello, Russell.
Hi, Christian.
Nice to see you.
Welcome. Nice to see you.
Thank you for having us over today.
In my office.
Okay.
We're going to work on Christian with a technique called BioSET. And this technique utilizes a couple of different things. One of the key cornerstones to it is the IQS system, which is short for interrogatory query system. And basically, that's just a fancy term for a computerized device that's taking biofeedback measurements from the body and then we're interpreting those results. If you'll hold that in your other hand, that would be great, yeah.
Mm-hmm.
And if you would, let's just do it that way, that way the chord's a little clearer. Okay, so you're holding that end, and that's keeping you grounded to the system. And I'm going to test a point, a palm point. And these correspond to acupuncture points in your meridian system, which of course your meridians run all through your body, just like nerves, or very much like nerves. And so we're looking for a meridian point that's in your palm. There's several we can use, but generally I will go for one that's more or less in this area of the palm. And I want to just test to see that it has good conductivity. So we're just going to do like a calibration often. So once I find a point that I feel like I can work with on your hand here, I am plugged into your matrix. And that's what we want to do. With a new patient, let's see what kind of stress you might have going on in your body. Mm-hmm. And we can get very detailed with that. We can check stress in glands or particular organs or particular systems, mm-hmm. but we want to first kind of look for more generalized stress in the organs and glands in general. Mm-hmm. So it's good to start that way. So let's go through and just scan and do kind of a body assessment. When I'm testing you, I'm sending a signal out and we're testing electrical potential, and if there's some interference in that signal somewhere in your body, it'll show up as a red reading.
Okay.
So essentially it's just saying, yeah, there's some interference in there somewhere. And it could be any number of things. It could just be stress. Sometimes there's something going on in the system that it's fighting, an infection. And the remedy at right now is corresponding to key acupuncture points. These are gate points, called gate points in acupuncture, and they are key points that are very commonly used in acupuncture to help facilitate the movement of blocked energy in the body.
Okay.
So we're going to put those in there to help with these stressors we identified. So let's go ahead and do a clearing on you real quick. So I'm going to add some distilled water to this small container here, and the purpose of this is I'm going to create a virtual homeopathic remedy. Essentially, I'm just taking distilled water, putting it on the focus plate, and imprinting it vibrationally. So this is the part that gets out there for most people, because it's vibrational medicine. But basically what we're doing is we're electronically going to imprint it, and you'll hear a little chime when I do that, and it'll do a little thing here. And this is just imprinting what we have in these two columns into that water. And the reason we need to do that is because it's creating a imprint that solidifies the signal, makes it more, when we're testing, it's not so important to have it in a water formula. But when we're going to do a treatment, we need to create more of a physical kind of, almost like a battery cell needs a charge to work. We need a physical liquid container to kind of hold everything in.
Okay, I see.
Right.
I see. So the frequency of the stresses determines the frequency, the vibrational frequency of the water.
Right.
Yeah, they're not
Exactly.
identical, but they're complementary.
They're complementary,
Sure.
right?
Okay,
And
that
they're
makes
both going into that formula,
Okay.
and then that formula is going to be outputted to your body with what you're holding there.
Okay.
So essentially, we're sort of making a little vibrational remedy based on the testing, and then we're going to do a physical correction, which I'm going to show you now.
Okay.
And I think probably it's easiest just to turn you on your side, although we can go on your back as well. Now I'm going to walk you through a little breathing technique. Take a deep breath for me in, and just hold it in. Hold your breath just for a moment. I'm just going to tap down, and then exhaling. It's just a stimulation for your nervous system and your energy channels on your back, which correspond to all the major organs in the body. So after we do your back, what I do is I go back here, and we want to just look at how things look again, because we want to make sure that we're seeing a shift. We'll see where there were red readings all over the place. We should see all green readings. Sometimes it won't be. It'll still kind of be reading high. In other words, we'll be getting red readings where there's some stress. If that's the case, it's very easy to correct. We just work on your back a little more. And what I'm finding now is it looks great. So you can see this is how the blood was still looking after that first back session we did.
Okay.
And it was still kind of high. And then we turned you back over, and these three readings are what we got after. I'd like to have you just process this for a couple more minutes.
Okay.
I think it'd be a good idea. So the next step would be to, delve a little deeper, in subsequent visits and see what else is going on, with your body and where we might need to. And the nice thing about the system is it can kind of help us talk to your body, and then your body can help guide us as to what we need to do.
Can I sit up? Sure. Okay, great.
Let go of that. Now.
Yeah. Great.
Just open your mouth and drop it in without touching the plastic.
Okay.
Perfect. You get an A.
All right. Cool. Great. Thank you so much. Really enjoyed this, and I appreciate your time today. Okay.
Anytime.
Great. Back to the studio. Okay, we're back. So tell us again. So this BioSET technology that you're using, how is that built upon what you learned, the traditional Oriental medicine?
Oh, that's a good question. It definitely, there's a lot of relationship between when we're scanning and using the technology. Well, what I'm often scanning for, it can be many things, but oftentimes I'm looking at what's going on in the meridian system, which of course is an ancient system, which, in China was discovered millennia ago. But we've taken and created a modern twist, and really this is an evolution. The technology I use is an evolution that's gone on since the 50s or 60s with using technology to find acupoints and verify that they exist and where they are by changes in electrical conductivity on the skin. Electroacupuncture, according to Vol, or EAV, this is exactly what we're doing. We're finding acupoints on the skin and going, aha, there it is. Well, that's how this started. This is just way down the evolutionary track from that, where we can not only, yes, we know we can verify energies, topically with a probe without having to actually, puncture the skin. Not only that, but we can access so much information inside the body. It's almost like you're the computer and I'm just plugging in a USB port, and we can just, the body can just give us a wealth of information if you know how to access it.
Cool. Yeah. Okay, and are there any conditions that lend themselves best to this type of work?
Yeah, right. That's a good question. This kind of work is extremely broad in its application. I mean, my practice, I do a lot of allergy work, and that's kind of one of the things BioSET's gotten kind of famous for. But in working with allergies and immune problems, we find that there's so many things that play into that, and there's also so many other conditions that can be helped with it. Digestive problems is very good, skin problems, headaches. I mean, there's a long list of things. Hormone imbalances, all sorts of things, food allergies as well as environmental.
Pain is a big part of your practice?
Absolutely. I often will use acupuncture, traditional acupuncture with that, but sometimes I won't. Sometimes I'll simply use the IQS system, and you'd be amazed at the results I've gotten even with that, without even invasive, doing any needling, at improving pain, especially spinal, because as you saw in the video, I was stimulating your spine, and so that can do quite amazing things. Even that gentle stimulation, coupled with the IQS biofeedback that the body's receiving, can work wonders.
Interesting. Okay, and when you were manipulating my spine, you were working directly with the chi?
Absolutely.
Okay.
Yeah, absolutely. And both the chi and physiology, of the body, the nervous system, the brain, all of that.
Okay.
Is involved.
Cool. And just one last thing, you do. This is your primary practice is based around the IQS system,
right?
But you still do some herbs and some acupuncture.
Absolutely, right? Yeah. I mean, it's my traditional training, and I would never want to not have that be integrated into what I do. And to some degree, it's integrated in the IQS and the BioSET system anyway. So it's very much a part of what I do. But I integrate it on occasion with people who come in with an acute injury. Maybe I'm seeing them for something else on the BioSET IQS system, but maybe they come in, they were playing tennis and whatever, they get tennis elbow, for instance, and I may feel like they need some acupuncture for that particular condition if they're open to it. And that can be really helpful. So, there's all kinds of situations where I may, even with Chinese herbs as well, I may think a person needs a particular remedy constitutionally. And one of the beauties of the IQS system is, say I have some Chinese remedy or something that I want to see if it's going to work for their body. Well, rather than having to have them just take it and, go off of just, knowledge that I may have in Oriental medicine, which is great, the pulse and the tongue and all that, it looks like this should be effective for their constitution. But with the technology of the IQS, I can also see if it looks in real time good for their body, meaning that they can hold that particular remedy. I can test for it on the machine and see how positive their body is responding to it electronically, which is really a neat tool.
And that sounds like a great idea. Like you said, instead of sending them out, come back in 2 weeks.
Have them say, oh, that's not really working, or or worse yet, oh, I've had side effects that weren't great. This can really give me an idea of how the body's going to respond to it immediately, in real time.
Okay.
So it's pretty neat.
All right. Well, now, anyone out there who's interested in learning about this BioSET technology, you can go to www.bioset.net. That's a resource for them.
That's the official site. And there's also a practitioner locator there, too. If they don't live in New Mexico, if they're somewhere else, they want to find a practitioner.
Excellent. Okay. Now, and if you wanted to if you lived in New Mexico and you want to work with Russell, he can be contacted at his website, drrussellbaum.com. Right. That's a good way they can reach you. So, well, great. Thank you so much for coming down and sharing your expertise with us. And I enjoyed having you.
I enjoyed being here, Christian.
Okay.
Thank you.
Yeah, you're welcome. Oriental medicine is a very broad topic. We might have to have you back on in the future.
It is.
Okay, great. I want to thank Russell again for coming on the show. Now it's time for our weekly book review. We call it Desert Island Books. If you were on a desert island and you had all of your necessities, food, water, shelter, clothing taken care of, and you had some room for some luxury items, these are the books you'd want to have with you. This week we're going to review There Is Nothing Wrong With You, Going Beyond Self-Hate. This is by one of my favorite authors, Sherry Huber. She's a Zen teacher from California. Basically, this book is about ways of skillfully dealing with a punitive, critical self-judgment voice that you may hear in your head. A lot of people hear it. I know I do. Some people recommend affirmations for dealing with that, but there's a spiritual teacher I like named Adi Shanti, and he points out that affirmations are fine right up until the moment someone tells you you're a schmuck, and then it just goes out the window. So Sherry has a different approach, and her means of dealing with this voice is to actually see through it and see how it's not real. She's written a bunch of books, and most of them deal with this same subject, but I think this is her best one. There is nothing wrong with you. And she is a Buddhist, but I assure you she's not looking for any converts. If you're a Christian, Muslim, Jew, Sherry doesn't care. If you're suffering with a voice telling you what a worthless person you are, then give this book a try. It's excellent. If you don't have that problem, if you're fortunate enough, you don't need it. Don't read it. But I think a lot of people can relate to it. So this book absolutely gets Dr. O's Golden Stethoscope Award. Okay, well, it's about that time to wrap up the show. I want to thank everyone here at Quote Unquote for giving us the airtime. I want to thank Colleen and Funky J for doing all the behind the scenes work. I particularly want to thank the viewers for watching. If you like the show, you can come back and see us next week at the same time. Tell your friends about it. You can check us out online, www.pathtowellness.net. If you have any questions, comments, or suggestions, you can send them to me at dro@pathtowellness.net. Before we go, we would like to leave you with something to chew on. We call it the cud. This week's cud comes from my favorite Trappist monk, who also happens to be a student of Eastern esoterica. I'm sure dozens of people are coming to mind right now, but I, of course, am talking about Thomas Merton. And Merton wrote, "If we could see ourselves as we really are, if only we could see each other that way all the time, there would be no war, no more hatred, no more cruelty, no more greed. I suppose the big problem we would have is that we would fall down on the ground and worship each other." How lovely. So, thanks a bunch for watching. Remember, it's your body, learn to care for it. It's your mind, learn to focus it. It's your heart, learn to awaken it.
Keep on opening doors. Let the past